Hello and Assalamu alaikum. Ultrascan Diagnostics. Say this is the CBCT of the patient that you had requested. We don't have a clear area of interest, so we'll just go through the generalized CBCT that we have, starting with the upper right seven. The upper right seven, we have an endodontically treated tooth that you can see. It's clearly fractured. We have got a periapical radiolucency, which is also involving part of the sinus right here. So no bone for immediate implant placement in the seven. Approximate ridge width in this region I can guide you is going to be 15 millimeters, but no bone for an immediate because of the infection and the sinus relationship. This is the upper right 6. Again, severely compromised, periodontally compromised, no bone, width of just 14, but no bone in terms of height. This is the upper right 5, severely infected periodontally. We've got 9 millimeters of width with only 6 millimeters of height. In the upper right 4, again you can see no bone, periodontally compromised. The canine also has very poor bone support. This is the upper right lateral. Again, absolutely no bone in terms of periodontal health. 6 millimeters of width, 15 millimeters of height. This is the upper right central incisor region. This is the central incisor. Again, this is floating. You've got absolutely no bone and very close incisive foramen. 5 millimeters of width, 10 millimeters of height in the central region below where the infection is. This is again the upper right central, upper left central, very poor bone here as well. We've got just 5 millimeters of width with 9 millimeters of height below the floor of the nose. The lateral again, very poor bone health periodontally, just 6 millimeters of width with a good 13 millimeters of height. The canine on the left side is also not doing very well, very poor bone quality here. This is the upper left premolar. Here we have some form of bone, approximately 8 millimeters of width with 12 millimeters of height, and this is the D3 quality bone. This is the upper left 5. We've got again very poor health here. Bone loss significant, 8 millimeters of bone with 10 millimeters of height. The upper left 6 also shows periodontally compromised. Furcation is involved, and then we've got an approximate ridge width of just 10 millimeters and a height of only 3 millimeters. The upper left 7 is extracted, but this area has no bone as you can see right here, and this is the upper left 8. This is the lower left lateral incisor. We've got very limited bone available here. Moving to the lower left central incisor, again significant bone loss. Only have an approximate ridge width of just 3 millimeters. Moving to the lower right central incisor, the incisor region has no bone in the lateral. The canine has good bone support, so here approximately if it is extracted, you have a ridge width of just 6 millimeters and a height of approximately 10 millimeters. The lower molars also have significant bone loss, as you can see right here. If lower molars are to be extracted post extraction, ridge width will be evaluated.